All right, welcome everyone to this session of the 2024 Culture of Data Conference. Thank you for joining us. My name is Allison Rosenthal. I use she, her pronouns, and I will be moderating this session today. We also have Ezra Moss here. He uses he, him pronouns, and he is managing the Zoom and making sure all the tech is running smoothly. You are all muted now, but if you have a question during the Q&A session, please feel free to unmute. You can also use the chat box if you have questions or need anything. If you are comfortable doing so, please add your pronouns to your Zoom name by clicking the 3 dots on the video square and selecting rename. We have one presentation during this session today. They will present for around 25 minutes, and then there will be 10 minutes for Q&A afterward. This session I'm really excited about because it's one thing to build a dashboard, it's another thing to try and get some community feedback, and I'm just really excited to hear about their methods. So with that, I will now turn it over to Leslie Frank and Sarah Solberg to present using visual methods to engage communities in the development and evaluation of the Colorado HIV and AIDS strategy.
Great, thank you. I'm going to go ahead and share my screen now. So let me pull this up. Okay. So I'm hoping you all are seeing my screen here.
Yep, looks great.
All right, well, thank you and welcome. I'm Leslie Frank, and I'm the Data Analytics Program Evaluation and Surge Program Manager at the Colorado Department of Public Health and Environment, Office of STI, HIV, and Viral Hepatitis. And I'm joined today by Sarah Solberg, an evaluation analyst who's also in our program with the Office of STI, HIV, and Viral Hepatitis. Okay. So first, we will be giving a little bit of background around our Colorado HIV and AIDS strategy, which we lovingly call the CoHAS. And we will discuss how community was engaged throughout the development of our Colorado HIV and AIDS strategy. We will be discussing the importance of data visualization and engaging our community in these important conversations. And then we'll be talking about our next steps as we start to evaluate these efforts and the work that Sarah is doing to continue to engage our community with dashboards. So the Colorado HIV and AIDS strategy is Colorado's strategic plan to end the epidemic in Colorado and ensure equitable outcomes for people living with HIV. It focuses on 4 key goals: preventing new HIV infections, improving outcomes and quality of life for people living with HIV, disrupting inequities, and implementing an integrated and coordinated effort to achieve positive outcomes. The CoHAS incorporates bold strategies to achieve these important goals and was developed after extensive community engagement and a comprehensive statewide coordinated statement of need. And most importantly, our community, those people living with HIV, people who are vulnerable to the acquisition of HIV, as well as many of our partners, advocates, and agencies doing this work in those communities, drove much of our CoHAS process by providing valuable insight, feedback, and edits as we developed our strategic plan. So as I mentioned, many groups came together to support this work, including our Part A Planning Council, which is housed within the Denver Department of Public Health and Environment, our Colorado Alliance for HIV Prevention, Care, and Treatment, as well as many community advocates working across various groups in Colorado. We incorporated community voices throughout. We gathered input and synthesized data from more than 1,200 individuals across Colorado through focus groups and surveys. In utilizing this data, we developed a needs assessment to summarize our clients' needs and priorities as we move forward with our statewide strategy. Clients' lived experiences in accessing HIV medical services, their interactions with medical providers, as well as their experiences in navigating Colorado's support systems, such as accessing housing services, substance use treatment, psychosocial supports, All of those things were prioritized throughout. We also were very deliberate in making sure that we invited people to the table who traditionally, whose voices are traditionally not incorporated into processes like these. So in particular, we made a concerted effort to reach out to communities of color. We also made a concerted effort to reach out to the LGBTQIA+ community, including people with trans experience. And then we also worked to try and outreach to folks across various geographic locations across the state. So both urban and rural, southern, western slope. We wanted to make sure that we had people at the table from a variety of different communities with different experiences. So why is data visualization important to this work? So data visualization promotes awareness around those social factors that drive our HIV epidemic, such as socioeconomic disparities, HIV-related stigma, discrimination, and structural racism. It also increases the use of data to inform decisions, and it promotes the effective use of data to inform the targeting of our limited resources. It allows for increased opportunities for participation by improving access to data for communities and empowers communities towards advocacy and action. And it has served as the foundation of our conversations with community. So we used data visualization throughout the development of our CoHAS, and we believe that the data visualization was an important effort in engaging our community. So I've linked here to our statewide coordinated statement of need, and if that link isn't working for folks, just please reach out via email, but it is on our office website as well. But you can see the many ways in which we incorporated visual data visualization throughout our statewide coordinated statement of need. We also use visual methods in capturing data, which I'll be talking about first. So we used visual methods during community listening sessions. And then up next, Sarah will be talking about how we're using visualization in our monitoring and evaluation to continue to engage community in these conversations. So, as I mentioned, Sarah and I will be focusing on the two ways in which data visualization was used to engage our community, both in the development of the CoHAS and now as we move into the evaluation stage. But I also want to recognize that there were many other data visualization products that were developed during this process. And so if you go to our website, you'll see kind of the many ways that we try and give community access to our data through dashboards and reports. And so all of those things are on our website. So I really encourage folks to take a look. And so up first, I'm going to be talking about how we utilize graphic recorders to facilitate community conversations and listening sessions. Graphic recording are visual methods that can be used to engage participants during focus groups, capturing themes, key ideas, and direct quotes in real time as the conversation progresses. The graphic recording process allows for participants to react to ideas, correct any misconceptions in the room in real time, and it also allows participants to see the data in a visual representation. And we have found that in those conversations where we've had a graphic recorder present, that our community is more engaged in providing their experiences. And I'll just lift up one of the messages from this morning that, that lived experience is also lived expertise. And so I just want to say I really loved that from this morning's talk. So it kind of lifts up their expertise, their experiences, and helps us understand what our next steps for bold strategies might be. All right, so here is an example of one of the graphic recordings that was captured during our Communities of Color listening session. And I'll say we had 7 different listening sessions using various formats. So we had some that were hybrid, both virtual and in person, some that were in person, and some that were just virtual. And we worked with organizations like It Takes a Village and other organizations across the state who have authentic relationships with those communities to help us facilitate and host these listening sessions. And you can see here some of the key themes that emerged in our communities of color, but I'll highlight a few things that came out of these conversations with community. So peer support and peer advocates were something that really emerged in many of our community listening sessions. And so we're really taking concrete steps right now at the office to identify ways in which we can provide stipends to individuals to provide their expertise as peers. Folks from our communities really wanted to have providers and the people that they're working with really sort of reflective of their community. And so we're trying to make sure that, we're promoting diverse hiring and those sorts of things within the organizations that we fund and within our own organization. People living with HIV really push back on a lot of the work that we do around viral suppression. So I think often in public health, we tend to focus on clinical outcomes. And they really wanted us to take a broader view and look at them as a whole person and really understand their quality of life in addition to some of those clinical outcomes for people living with HIV. It came up frequently that folks had a hard time accessing services. And so how can we improve our enrollment processes and just make it easier for folks to get into those services they need to support their care and their quality of life. There was an overriding theme around providing advocacy and education around sexual health and HIV. And then leading into that, also understanding and addressing the root causes of HIV-related stigma. And then this next graphic recording I'm going to show you was a listening session that we did with the trans community. And It Takes a Village was also a key partner in hosting this listening session and recruiting participants. And what I thought was really great throughout these listening sessions is that even though it was really unique groups each time coming together to talk about their experiences and the strategies and the work that needs to be done, a lot of the same themes really emerged. And so that was really helpful in our next steps, being able to identify what was important. A lot of similar themes emerged in the trans community listening session, peer support, stigma, accessing care, whole person care. Some unique things that did emerge from this listening session that we didn't hear from other groups were the trans community spoke in particular about violence and intimate partner violence. And so that's something that we're really trying to take a look at on our end, if there's services or supports that need to be provided around those factors. And then discrimination really came up in this conversation too with our trans community. And so talking about discrimination that they felt from their healthcare providers, their community, their families, as well as their employers. And then lastly, another theme that emerged here is sort of in addition to this idea of whole person care, we really wanted to make sure that providers were addressing their trans care in addition to their sexual health and not necessarily ignoring their needs as a trans person and kind of finding a way to be more comprehensive around those issues. And all of these graphic recordings, I believe I've linked in our presentation. You can see all of them that we did. I'm just sharing 2 of the 7 here today so that we have enough time to discuss our next steps. But this last slide is really those main themes that emerged from all of our listening sessions. And these are really things that we go back to time and time again to make sure that we're centering our strategies around these issues for our community. So now I'm going to go ahead and hand things over to Sarah, and she'll discuss how we are using data visualization to engage communities for our evaluation efforts.
Thank you, Leslie. You can go to the next slide. Awesome. So I'm going to be discussing how we've created a monitoring and evaluation tool for a wide audience based on what Leslie has already told us about the development of the CoHAS and how we have harnessed visual methods to disseminate quantitative data. And it's been a few minutes since Leslie told us the CoHAS acronym, so I'm just going to say it again because I'll be mentioning it about 150 more times. But CoHAS stands for the Colorado HIV and AIDS strategy. And this iteration of the strategy covers years 2022 through 2026. And so as Leslie mentioned just now, the CoHAS features 6 core theme areas, which each have a goal. And under each goal, there are 3 types of measures. The CoHAS, including the evaluation plan, was determined by a steering committee that Leslie also talked about earlier, which was made up of a wide variety of community members who brought their lived experience to determine these indicators that went into this dashboard. So the dashboard is intended to provide ongoing data updates on these lead indicators under each CoHAS goal to a wide variety of stakeholders, including staff here at CDPHE, community advisory groups, providers in Colorado, people living with HIV, and other members of the public who may be interested. You can go to the next slide. So when setting out to design this dashboard, the first challenge was deciding how to structure client level and aggregate level data from across over 10 data systems to feed into a single digestible and filterable dashboard. So data team members each had to develop a process for pulling, cleaning, and transforming data from each of their specialty areas into the singular input structure. And throughout the summer and fall of 2023, we shared the draft of the dashboard with both internal and external stakeholders and collected and incorporated verbal feedback as well as feedback submitted through email or an anonymous Google form that we provided to anybody reviewing. And in November of 2023, we launched the public dashboard and have been updating it quarterly since then with new data. We regularly disseminate this tool through email newsletters that go out to interested members of the community, as well as a public link on our website and regular standing meetings with a few of the community advisory boards. Next slide. So this is a snapshot of the main page of the CoHAS dashboard. And so it's designed to be easily navigated by a wide variety of users. And they land on this page up first, where they can find the navigation buttons to get to any of the components of the dashboard. In addition to, across the bottom, you'll see a bunch of different buttons that'll take you to instructions for use, links to more resources, and anything else they might need as context to understand what's included in this dashboard. So I'm going to briefly break down the basic structure of the data that we put into this dashboard for you. Next slide. So the first of these is the lead indicator categories. So this is the first way that users can choose how to view the data. And these categories are the buckets in which the CoHAS goals are organized. So we have PrEP, which is a preventive HIV medication, in addition to HIV testing and syringe access services, which are all publicly funded HIV prevention services in Colorado. There's also components of surveillance data. Here it's represented as new HIV diagnoses, followed by publicly funded HIV care and treatment services, and then aggregate provider and community level measures. Next slide. And the second way that users can choose how to view the CoHAS data is by priority population. So these were chosen as a result of the disparities in access to services and disproportionate burden of HIV in Colorado. And all of these were determined by the CoHAS steering committee and the different work groups and listening sessions that Leslie talked about earlier. So on the right, I've included a few examples of some of the data that led to the selection of the CoHAS priority populations. So for example, individuals in Colorado who identify as Black or African American have an HIV incidence rate that is almost 6 times higher than that of white non-Hispanic folks in Colorado. Another example of this is people living in rural areas of Colorado accounted for 8% of all new HIV diagnoses, but 35% of late-stage HIV diagnoses, which means that the HIV virus had progressed to the point of an AIDS diagnosis before or soon after they were diagnosed. So these are clear examples of where there are gaps in services, which are why these are priority populations that are focused on in the strategy. Next slide. So here's an example of a category-specific dashboard page. It shows priority population breakdowns with trends denoted by icons, which are also differentiated by color, and some easy to understand charts. The right portion of this slide shows an example of what's called a tooltip, if you're not familiar with Tableau dashboard terminology. And that just means it's the information that pops up when hovering over a data point on the dashboard. So we've organized the dashboard to provide some high-level upfront summaries for folks who are looking for simple trends and just want to see what's going on, while those who are looking to answer more specific questions with this data can dive deeper. Next slide. So shown here, we have what happens if you click the show me more information, more details on the bottom of each category page. And so this will pop up and it'll show them a little bit more detail if they're interested. Next slide. So the honest truth is that the data we work with is super complicated. This dashboard is intended for wider public use than a lot of the other data products we work with. So we had a renewed focus on accessibility and inclusivity when building this. I want to acknowledge that I am nowhere near an accessibility expert when it comes to data visualization or any online tools. But these are some of the ways that we have incorporated accessibility in the dashboard. And they're highlighted on this slide. And we continue to work on it every day. So people are coming into this tool with varying levels of data training, as well as varying levels of familiarity with HIV clinical terminology, for example. So with this in mind, we designed each dashboard page to include accessible color palettes and plain language ideas and explanations. Another way we aid understanding with the dashboard was adding an information button to each page, denoted in the top left of the slide here with the circle with the little eye in it, which when clicked pops up with data interpretation help, context, and acronym meanings. We also have developed a user guide, which is accessible from a button on the main dashboard page, which highlights the features of the dashboard, how to use the filters, etc. And the choose your own adventure aspect of the dashboard allows for optional deeper dives for folks who want to see more information, like I mentioned before, but they're not shown automatically. And this is so that there's not an overwhelming amount of data that can make people feel lost when they first open a really busy or overwhelming dashboard. And we live by the principle that the less you have to guess about a visualization, the more you can understand what it's telling you. Next step, or next slide. And we also cannot ignore how structural inequities have shaped all public health, and HIV is obviously no exception to this. As many speakers today have already emphasized, quantitative data doesn't tell the whole story. And while this quantitative data visualization tool is only one component of the CoHAS evaluation efforts, we still need to ensure that we're extending these equity practices to the data visualizations we create to adequately report back to the community. So first, we wanted to make sure that the dashboard centered transparency in both the process and outcome of the evaluation efforts by being clear about how the CoHAS was developed and how these indicators were chosen. And by including a link to the anonymous feedback form, we wanted to ensure continuous opportunities for feedback or questions among anyone viewing the dashboard. So we didn't want to just have it be available in meetings or people who might just have access to folks in our office. We have also strived for dissemination to broad groups of stakeholders, which will allow for accountability to the CoHAS goals, as well as hopefully a wide group of people can use the findings to inform their own programming and advocacy. We are super fortunate to have two amazing community engagement coordinators in our office who have done a really great job facilitating the dissemination and discussion of CoHAS progress, including use of this dashboard. One thing I also want to note is that across all of the work in our field, we strive to use people first language. And while this may sound like an obvious practice, unfortunately, I found that in the field of infectious disease or outbreak investigation, it's not always a common practice. So for example, in the dashboard and in all of the work we do, we use the term people living with HIV versus referring to folks as quote unquote cases, which is dehumanizing and can be stigmatizing as well. And as responsible data stewards, we are committed to protecting anonymity on the data. So each category is reported on its own in aggregate, which means that you can't filter down past the level of one variable at a time, which protects any level of detail that could be potentially identifiable. At the same time, we also want to honor folks' identities and how demographic summaries do not reflect the wide spectrum of experiences that people within these categories live. Unfortunately, the nature of the data we work with is often only available in preset categories, but where possible, we allowed for expanded demographic categorizations. So for example, in this dashboard, we included all combinations of race and ethnicity identity that were available. So in this, we have 24 race and ethnicity intersections, rather than including fewer, where many identities are lumped into other, for example. Next slide. I also want to touch a little bit on the challenges we come up against when developing data sharing tools for a wide audience. I think just looking at the beautiful data sharing tools that were shared earlier today, like the Colorado Equity Navigator and the Lotus Project, I think we can be tricked into thinking that this is easy work, and it is not. With the CoHAS dashboard, for example, we are pulling and attempting to align data from a large variety of data sources, which are managed by different groups and can lead to a lot of different inconsistencies that we have to grapple with. For example, gender identity categories in the surveillance data do not include options for gender nonconforming or describing your gender in another way, which limits how much we can identify service utilization disparities among folks who might identify this way. This dashboard also includes a lot of content. And as we're currently exploring translation into other languages and developing screen reader friendly alternatives, the sheer quantity of content in this dashboard makes that a very, very big lift. Another component of inclusivity and accessibility efforts that rarely gets discussed in data visualization is that these efforts can result often in more words and explanations on a page, which can lead to overwhelming or potentially busy visualizations, which can be create a barrier to understanding for some people. As an example, oftentimes using people first language or adding explanations to get a clearer understanding of a visualization, it adds words to a page, to put it simply, which in efforts of simplification of visualizations can be a challenge. And as I'm sure many folks in attendance today can relate, when we're deep in data analysis mode, especially with quantitative data, it can be a challenge to relay the larger picture in simple and plain language. So these principles that I've talked about with the challenges can lead to a constant push and pull between our two goals of both simplification and accessible information sharing. And in fact, I saw that there's a session on accessibility and data visualization right after this. So I'm really excited to attend that and learn a little bit more about some things we could do for this dashboard. But in the end, with this dashboard and beyond, we sometimes have had to sacrifice a little bit of simplicity in the visualization in favor of accessibility and inclusivity. And again, it's nowhere near perfect. We're always learning, gathering feedback, and adapting tools like these. Next slide. So an advantage of using a dashboard like this, rather than writing something like a static report, is that it can be a living product, like I just said. We get to be flexible and adapt based on the data needs of the community and different stakeholders and the feedback that we receive. We're currently exploring all sorts of adjustments and developments, some of which are mentioned here. And it is wild to say, but time does fly. And since this CoHAS covers the years 2022 through 2026, It actually won't be that long before we're writing the final evaluation report, and hoping to use this as also to use it as a needs assessment for the next iteration of the CoHAS. So in all community engagement efforts that our office does in both CoHAS and beyond, we are continuing to incorporate lessons learned and best practices and utilizing visual methods to both gather and share information back with the community. Thank you.
Great. I just wanted to thank Leslie and Sarah for that presentation. It was really informative, and you guys have done so many cool, innovative methods to really capture community feedback, and also to make your visualizations accessible. Please feel free to enter in your questions either in the chat, or you're welcome to come off of mute. Looks like we have a question from Lena. Sarah, you mentioned inconsistency across data sources as one challenge. How do you all manage that as so that you're still able to be representative as possible?
Yeah, great question. I think a really unsatisfying answer is that it depends. When I'm talking about something like the survey, like a lot of times HIV epidemiological data won't have gender nonconforming as an option. In that case, when we do want to compare sort of the program data we have, so like we want to compare like the folks who are being diagnosed with HIV with the folks who are receiving publicly funded HIV care and treatment, for example, that is a time when we do, have to have a category that's, gender nonconforming or other, which, is not ideal. And then sometimes we also have kept the disaggregation with the caveat that like one data source might not collect it that way. So like, for example, I think the race and ethnicity categories between the different data sources vary a little bit. And so we have, a little asterisk somewhere in the dashboard that's like, this is how it is collected with this wording in one data source versus this wording in another. And so we want to make sure that there's transparency as if we are sort of lumping those together.
Oh, great. We have a question from Carol. Sarah, what tool did you use to build your dashboard, and how did you publish it?
Great question. And I'm sorry I didn't mention that, but this is was all built in Tableau. So I built it in Tableau desktop, and then, and Leslie, maybe you can talk more about the server, but there's a public server that we are able to publish to as well.
Yeah, the state gives us access to a public server for Tableau. So we have two servers, one that's secure that you have to log into as a state employee, and then another one where we're able to kind of have public access. So.
Oh yeah, and I had a question for you, Leslie. With the graphic recordings that you all are doing, are you incorporating that into like qualitative analysis that your team is doing? And like, and I imagine like the graphic recordings just really help speed that process along. Is that what you found?
Yeah, so we don't do, we haven't done any formal qualitative analysis with it, but we have done high-level theme extraction where we've kind of coded those high-level themes just to inform which themes emerge throughout all of our listening sessions, and just make sure that as our team was working through the strategies for the CoHAS with our community, that we were giving them that information to sort of let them know here are some key things that are emerging. Here are patterns that are emerging across the various listening sessions. And yeah, the graphic recording definitely helps facilitate that, because we gave her our focus group sort of guide ahead of time so that she could sort of set up the structure ahead of time before the listening session started. And then it was just kind of nice as she went, she was able to kind of categorize things. And if And it's all digital, so she's able to quickly erase, or our community was able to even say, like, I actually think that this should go under this subheader if they saw her sort of misclassifying something. So, yeah.
Oh, that's really cool. Yeah, I've been in places where they've done it on like pen and paper. That's a really nice feature with the digital.
Yeah.
Sarah, and I had just like another kind of quick question for you just about the dashboard. When you're building your dashboard, are you using like line level data and then having Tableau do all the calculations, or do you do any processes to like aggregate the data before you feed it in? It just sounds like it's probably very complicated with using multiple data sources.
Yeah, great question. So I guess the short answer is that I aggregate it outside of Tableau and then get it in there. But we have, so I personally am on the evaluation team. So the data I primarily work with is the program data. So anything that has to do with funded prevention or care and treatment services funded by our office. And then there's another side to our team that works primarily with the epidemiological data. And so everybody has different areas of expertise with the data. And so what we did was create a skeleton data input document where everybody takes the data from their own, line list area of expertise and then puts it in there in a uniform format so that we can feed it into the dashboard and not have to do too much once it's already in Tableau.
Oh, nice. Yeah, that sounds like a good strategy.
Even as is, it takes a while to load though. There's still a lot in there, even aggregated.
I feel that, yeah. All right, yeah. Guess I'm not seeing any more questions from audience members. So just wanted to formally kind of like wrap up this session and give you all a couple announcements before you head out. So thanks all for attending this session. Slides and any additional handouts the speakers have provided are available on Sched. You will receive a conference evaluation form via email after the conference is over. We use this information to help us on the planning committee, and we would love it if you would fill this out. There will be a raffle for everyone who completes the survey within 2 weeks, and you could win one of two $50 gift cards. And now now you have like a 15-minute break. The next session begins at 2:30. There are 3 sessions to choose from, and Sarah did a good job of plugging the accessibility one that's coming up. And then also, don't forget to stick around. We are going to do a day 1 debrief session for some casual networking and fun trivia. So thanks all, and hope you have a good rest of your afternoon. Yeah, thanks Leslie and Sarah, really great presentation.